Hi, I'm Greg Stanley, President of Whitehall Management Services. For the last 30 years, we've worked tirelessly to help doctors get out of debt, save money, and hopefully retire financially independent. We've done this through an emphasis on conservative money management and careful practice development. We're not what you'd call a big case group, meaning that the goal here isn't to sell everyone that comes into your office as big a case as possible. In fact, the biggest practices in the country have done just the opposite. They've taken a consumerist approach. We talk about consumerism and practicism. Consumerism is giving patients what they want. Practicism is giving patients what we want to give them. We've learned that over time, nothing is more costly than practicism. And left to yourself, it will naturally creep into your office. You know, when you start to deliver consumerism on a higher and higher level, you start to generate new patient referrals. People don't realize how powerful this concept really is. You can increase your consumerism to the point that you really don't have to worry about the competition in your community. The truth is, they have to worry about you. Because if consumerism could be measured and quantified, and you could deliver yours at a much higher level, not only do you attract patients to the office that just moved to the area and don't have a dentist, not just the people that aren't completely happy with their dentist to attract them to your office, but you could actually attract patients to your office that now think they actually love their dentist. When your patients go out so excited and positive about the experience that they've had in your office, they literally start selling people on why your office is better, until finally they're talking across the back fence and the person who thought they loved their dentist is saying, yeah, gosh, my doctor doesn't give me conscious sedation, and man, nobody did that for me, nobody sent me a birthday card, and the list can go on until finally people are thinking, you know, I guess I really didn't like my dentist as much as I thought I did. In fact, I just found out that at this dentist practice, you don't even have to pay for exams and x-rays. I'm going to check this out. You see what I'm saying? It's not just about getting referrals. You have to achieve what we call referral intensity. People refer to you with varying levels of intensity, all the way from kind of giving off that feeling, you know, when you ask them, hey, you went to that dentist, how did it go? They say things like, yeah, it was okay. Kind of communicates that it was about like you would expect, all the way to, man, you've got to go. It was incredible. From the time I walked in, there was somebody making a fuss over me. And all the way, I guess all the way would be the final level of referral intensity is where people just from your office actually initiate the referral. We have offices that actually do this. People leave their practice and call several people on their cell phone and start raving about how great the practice is. In fact, some of the offices, it's a regular occurrence. An office I was visiting in Atlanta, Georgia, it happened on average 2 to 3 times a day. So we're not just trying to generate referrals, we're trying to generate referral intensity and rid the practice of practicism.